Welcome to Coder's online YouTube channel. Today we will discuss about the anatomy, pathology and clinical procedures related to eyes. Eye. The eye is a sensory organ. It collects light from the visible world around us and converts it into nerve impulses. The optic nerve transmits this signal to the brain, which forms an image, so thereby providing sight. Eye is made up of three coats or layers enclosing various anatomical structures. The outermost layer, known as the fibrous tunic, is composed of the cornea and sclera, which provide shape to the eye and support the deeper structures. Middle layer, known as the vascular tunic, consists of the choroid, ciliary body, pigmented epithelium and iris. Innermost layer, known as the sensory layer, is the retina, which get its oxygenation from the blood vessels of the choroid. Choroid is posteriorly as well as the retinal vessels is anteriorly. The anterior segment includes the cornea, iris, ciliary body and lens as well as the spaces of the anterior and posterior chambers filled with aqueous humor. The posterior segment includes the retina, choroid and optic nerve head as well as the vitreous compartment filled with the vitreous humor. We will start with layers of an eyeball. There are three layers. Outer layer is fibrous layer, middle layer is vascular layer and inner layer is nervous tissue layer. Outer fibrous layer contains sclera and cornea. Middle vascular layer contains choroid, ciliary body and iris. Inner nervous tissue layer contains retina. First we will discuss about sclera. The white outer layer of the eyeball. At the front of the eye, it is continuous with the cornea. Sclera. Sclera is the white outer layer of the eyeball. Cornea is the transparent front part of the eye that covers iris, pupil and anterior chamber. Next one is choroid. Choroid is the vascular layer in between the retina and sclera. Ciliary body. Ciliary body is the broad membrane extending from choroid, which is responsible for the production of aqueous humor. Next is iris. It is a thin circular structure in the eye responsible for controlling the diameter and the size of the pupil and thus the amount of light reaching the retina. Eye color is defined by that of iris. Next is pupil. It is a hole located in the center of the iris which allows light to strike the retina. Next is lens. Crystalline by convex structure, it is suspended behind the iris. Retina. Retina is the light sensitive layer of the tissue that lies inside of the eye. Cornea is the transparent front part of the eye that covers iris, pupil and anterior chamber. Choroid is the vascular layer in between the retina and sclera. Continuation of choroid is the iris and the ciliary body in the anterior region. Ciliary body is the broad membrane extending from choroid which is responsible for the production of aqueous humor. Iris is the thin circular structure in the eye responsible for controlling the diameter and the size of the pupil and thus the amount of light reaching the retina. Eye color is defined by iris. Next one is pupil. It is a hole located in the center of the iris which allows light to strike the retina. Then lens. Lens is a crystalline by convex structure. It is suspended behind the iris. The lens is more flat on its anterior side than on its posterior side. Retina. Retina is the light sensitive layer of the tissue that lies inside of eye. Sends visual message through the optic nerve to the brain. Anterior chamber. It is an aqueous humor filled space inside the eye between the iris and the cornea's innermost surface. Posterior chamber lies in behind the lens. Vitreous humor is a transparent, gelatinous, colorless mass that fills the space in the eye between the lens and the retina. Photoreceptor. Rod cells and cone cells are there. Rod cells are the photoreceptor cell in the retina of the eye that can function in less intense light. And the cone cells are responsible for color vision and function best in bright light. Macula or yellow spot. The macula lutea or macula for short is located in the central retina area lateral or to the side of the optic nerve and processes only the light that comes from the center of the visual field. Macula contains mostly cones and few rods, and the fovea centralis contains only cones and no rods. Fovea centralis. It is located in the center of the macula lutea or retina. It is center of eye sharpest vision and the location of most color perception. It is because of the presence of high concentration of cone cells. Blind spot or optic disc. The place where the optic nerve connects to the retina in the back of each eye is known as optic disc or blind spot. There is a total absence of cone cells and rod cells in the viscera or photoreceptor cells. Hyoid canal. It is a small transparent canal running through the vitreous body from the optic nerve disc to the lens. It is formed by antivagination of the hyoid membrane which encloses the vitreous body. Conjunctiva. It is a thin membrane covering in the front surface of the eye and inner surface of the eyelid. There are 7 extraocular muscles. Functionally, they can be divided into 2 groups. Recti and oblique muscles are responsible for eye movement. Levator, palpebrae and superioris responsible for superior eyelid movement. Next is visual field. Refers to the total area in which objects can be seen in the side vision as you focus your eyes on the central point. Visual acuity. A measure of the ability of the eye to distinguish shapes and the details of objects at a given distance. Next we will discuss about pathology or disease condition of eyes. First one is refractive errors. In refractive errors we have myopia, hypermetropia, presbyopia and astigmatism. Myopia or nearsightedness, far away objects are blurry. Hypertrophia or farsightedness means nearby objects are blurry. Presbyopia. In old age, lens get harder and less flexible and stop focusing image correctly in retina. Next one is astigmatism. Far away and nearby objects are blurry. Next condition is cataract. Cataract is an eye disorder in which clouding of lens occurs and causes clouding of vision. Next one is strabismus. It is a condition occurs in which there is no alignment between both eyes. Next condition is glaucoma. In this condition, damage occurs in the optic nerves due to increased intraocular pressure and leads to blindness. Next condition is optic neuritis. It's not optic nerve, optic neuritis. Optic neuritis is the inflammation of optic nerves. Pain and vision loss are common symptoms for optic neuritis. Next condition is conjunctivitis. Conjunctivitis is the infection of conjunctiva due to bacterial and other allergic irritants, also called pink eye. Next condition is macular degeneration. The condition occurs due to the degeneration of macula due aging causes blindness. Next condition is chalazion and site. Chalasia are enlargements of an oil gland similar to a pimple. It's deep in the eyelid causes by an obstruction of the gland's opening. So these are the pathological condition, and next we will discuss about clinical procedures. First one is evisceration. Evisceration is the procedure to remove all the eye contents, only leaving the scleral shell and extraocular muscle intact. Next is enucleation. Enucleation, in this case we have to removal of the eyes that leaves the eye muscles and remaining orbital contents intact. Next one is extrusion. Extrusion is a surgical procedure involving removal of the entire globe and its surrounding structures including muscles, fat, nerves and eyelids. The process fits over an orbital implant and under the eyelids. Next procedure is keratoplasty. Keratoplasty is a surgical procedure to replace part of the cornea with corneal tissue from a donor. There are three types keratoplasty: lamellar, penetrating and endothelial. Lamellar means partial thickness replacement of only part of cornea. Penetrating is the full thickness replacement of entire cornea, and endothelial in which only the endothelial layer is replaced. Next condition is keratomileusis. It is a surgical procedure for correcting the refractive power of the eye to improve vision. Typically involves reshaping the cornea in place with the use of a laser. Next condition is iridectomy. An iridectomy is the surgical removal of part of the iris. These procedures are most frequently performed in the treatment of closed-angle glaucoma and iris melanoma. Next condition is vitrectomy. Vitrectomy is the surgery to remove some of all the vitreous humor from the eye. Anterior vitrectomy entails removing small portions of the vitreous humor from the front structures of the eye, often because they are tangled in an intraocular lens or other structures. Next is cataract surgery. Cataract surgery is a procedure to remove the lens of the eye and in most cases replace it with an artificial lens. Types: ICCE, ECCE, phacoemulsification, lens replacement. ICCE means intracapsular cataract extraction. Involves the removal of the lens and the surrounding lens capsule in one piece. ECCE, extracapsular cataract extraction, involves the removal of the lens while the elastic lens capsule is left partially intact to allow implantation of an intraocular lens. Next is phacoemulsification, and the last one is lens replacement. Next is scleral buckling. A scleral buckle is one of the several ophthalmologic procedures that can be used to repair a retinal detachment. Retinal detachment are usually caused by a retinal tears, and a scleral buckle can be used to close the retinal break both for acute and chronic retinal detachments. Next one is strabismus surgery. Strabismus surgery is surgery on the extraocular muscles to correct strabismus, the misalignment of the eyes. And the last one is tarsorrhaphy. Tarsorrhaphy is a surgical procedure in which the eyelids are partially sewn together to narrow the eyelid opening. Thank you.